Norm?
I wonder, in your report on the cost, you talk a lot about state mandates that are added on to insurance. I know in Virginia, the legislature has passed mandates that require us to cover midwives, acupuncturists, mental health, social workers. Could you talk about that and about how the federal law would have to be changed to allow cross-border purchase of insurance?
You're talking with me. Not an expert on the federal law and what specifically needs to be changed, but a lot of the mandates, as you mentioned, are in state laws. So you could start here in Virginia and loosening those up. You need the federal government to do the cross-border. But
and if you don't have both of them, it's not going to work. I mean, you've got to be able to buy that policy in Carolina, Pennsylvania, whatever, to create, I think, the competition. But as Donna mentioned, the states are oftentimes, and they all come out with good intentions. The problem is we don't allow people to have a menu selection of what policies they could afford and which ones they actually need. Because if you combine some of these with a health savings plan, with a streamlined, catastrophic type insurance plan, that's all some people need and would cover them well in doing that. But I think Donna, wouldn't you agree we need to being able to sell insurance across state lines
absolutely,
to be able to get
it's
the
one
full.
of our recommendations.
You're going to have to change legislation. You're going to have to go from state to state to state, and the way it's set up right now.
But not if we could do the selling across state lines, because that would create a lot of pressure on those individual states to be competitive.
Right. No one would buy a policy in New Jersey
level.
anymore.
That's right. That's right.
But all the details are done.
Do you have a follow-up?
Savings accounts, because you talk about those in the report, but under the House Bill 3200, don't they effectively make health savings accounts illegal?
They're not going to meet the requirements, the mandates for a policy. So health saving accounts are out under 3200.
That's our reading of it. They may argue differently, but I don't see how health savings. I don't see how private insurance survives. Quite honestly, if you look at some of the strict reading down the road.
John?
Okay, mention was made about maybe dropping public option. People need to realize that the basic damage is done by the core of the bill, aside from public option. The core of the bill takes over federal control, basically, the healthcare industry in the country, regulating it. And we can't think we've got a compromise. We don't have public option, so it's okay. Fundamental evil is in the rest of the bill. There was talk about why we don't see Republican ideas coming forward. I've been trying to get Boehner and McConnell to come together, the conferences come together with a Republican alternative plan and announce it. Have a news conference, a joint news conference. Tomorrow night, there is an opportunity for that to be done to a certain extent when there's a Republican response to the president. I would ask if you might try to encourage Leader Boehner to promote the idea of getting some Republican alternatives brought up at the Republican response. They want to do it in part. They want the good, the best is becoming the enemy of the good. They want to see a CBO scoring of every proposal they've got before they go forward. And what's going to happen is that the game's going to be over by the time they get everything perfect. So hopefully you can support that tomorrow night.
Wayne?
Go ahead.
Michael?
What should we do?
I think what you're doing, I tell you, one of the things that's interesting to me, the 63-year-old man that I mentioned earlier that showed up on healthcare forums, he was just livid because they had said he was some kind of political extremist. And then he said to me that the next statement was, and this is the first time I've been involved in politics in my life. And I looked at him and I said, look, I said, forgive me for this. It's just there's some good principles there. I'm going to pull out an old story out of the Old Testament. And I said, there was a story that the trees came looking for a leader. I don't know if any of you remember this one. Not great story. The trees came looking for a leader, and they went to the olive tree. And the olive tree said, no, can't be your leader because I'm producing all this wonderful oil that men use to light up their houses and to celebrate the gods. Why would I give it all up and go sway over the trees, go get another leader? Went to the fig tree. Asked the fig tree to be the leader. The fig tree said, nope, I produce all this sweetness that men love to eat and their cakes and everything else. Why would I give that up and go sway over the trees, go get another leader? So they went to the vine, and the vine said, nope, couldn't do that because I produce all this wonderful wine that makes men happy and that they love and they worship me because of it. Why would I give that up and go sway over the trees, go get another leader? And so they went to the bramble, and bramble said, sure, I'll be your leader. And I looked at the 63-year-old guy and said, it's good news and bad news. Good news is you're here tonight. Bad news is where have you been for 63 years? And I think the great news is we're getting people that are standing up. And you guys have been there. Y'all haven't said, no, I've got too much to do, I can't do it. You've been here, you've been doing this. I think we've got to keep that fight going. What I've been telling everybody, don't think it's just in Washington. We've got to do it in the McDonald's and in Sunday school classes and the Cracker Barrels, every place you go, because that's what's ultimately getting these people, and they're starting to hear this from folks. And so I think we just have to keep that pressure on, not let up.
Last question, but I am certainly glad to hear that the vine turned him down.
Yeah, that's might have been better than the bramble.
Dodged a bullet there. Any other questions? Okay, we're going to call it quits here. Congressman Forbes.
John, thank you.
Thanks,
Donna
John.
Arduin, thank you very much for being here today. We greatly appreciate it.